over time. In this course, I'm presenting the healthcare domain, but I don't have everything on this slide. But if you have an idea of what's on this slide, you're good to go in the interview. Also check company website for information. There are tons of information there. Explore the application too. Learn about the lines of business for each product. So the key thing to take away from this slide is to keep glossary of terms. So if you are talking with a colleague or you're talking with your manager and they use an acronym or use something that you're not familiar with, when you get back to your desk, try to find the meaning. Use Google, or you could just ask your mate or your fellow employee to say, what's the meaning of that acronym? Write it down when they tell you. That's how you learn, okay? What is healthcare? Well, healthcare is medical action that is geared towards curbing illness or performance of necessary medical measures to improve a person's health, which may be done through surgery, administering of medicine, or other means. These are services offered through a healthcare system comprising of hospitals, physicians, with the aid of computer systems and medical laboratories. So in a nutshell, healthcare is just medical action that is implemented to take away sickness from a person. There are two types of healthcare application. This healthcare application is EHR and EMR. As you can see, we have the EHR, electronic healthcare records, and EMR, electronic medical records. The EHR is records that has to do with vaccination, fitness records, and medical records, and many more. Then the EMR application is application that has data for only medical related incidents. For instance, if you go visit the clinic, inpatient or outpatient, you will have your record, your data recorded. Any visit to the hospital, your information will be recorded. Even dental treatment, it will be recorded. Our focus today is on EHR, electronic healthcare records. The entities relating to healthcare. We have the patient, we have the provider, we have payer. So as you can see, patient is someone who has records or data with the healthcare, and provider is someone who provides medical service to the patient, and then payer is someone who pays the provider for the services that he gives to the patient. This is the healthcare process. You have a subscriber, you have healthcare provider, you have health insurance provider, you have explanation of benefits, you have explanation of payment, and then a bill is also sent, and then payment is made. Okay, this is just a very high level healthcare process, but then the application that implements this process is robust and detailed, extensive. The terms related to healthcare system. We have the health insurance, we have health insurance provider, we have healthcare provider, we have preferred provider, facility, member, and group. You can pause the video and get to know the meaning for yourself, because I already outlined the meaning. I don't have to read out the meaning, okay? We have the healthcare system data, and the data that's being recorded in the healthcare system has to do with biometric, PII information, which has to do with human metrics information, fingerprint, iris or facial recognition, your SSN name, email address, and so on and forth. We also have diagnosis, disease codes, we have treatment codes, we also have claims and billing codes. These are the information that the healthcare system records, and they are actually standardized way of storing or capturing healthcare information. The standardized coding system for the healthcare domain has to do with the ICD code, ICD-9 and ICD-10. The ICD-9 is the old version of the coding system, and the ICD-10 is the newer version. ICD-9 version is very inconsistent, and the newer version has been brought up to cover for the inconsistency in the version 9 of the ICD code. So the version 9 ICD code has 3 volumes. It has diagnosis codes, it has indexed listings, and it has tabular lists of procedures for inpatient treatment codes. Well, you don't have to know the details of all these, but just know that there are 2 standard codes, which is the ICD-9 and the ICD-10 codes. ICD stands for International Classification of Diseases. Okay. Composition of the codes. ICD codes, these are a system of diagnosis, medical composition, or billing codes to classify patient diseases and symptoms. The ICD-9 codes being discussed is referred to as ICD-9-CM in the US. The CM stands for clinical modification. Medicare began requiring the use of ICD-9 diagnosis codes on claims, and soon followed by commercial insurance providers. ICD-10 is code recognized by the World Health Organization. Well, before I continue, I would like to tell you that these codes are actually codes that relate to different kinds of diseases. If we may go to the slides we were on before, which is this one, the codes are actually meant to be assigned to diseases. Okay, so if there's any disease known to man, there's code attached to that disease. Okay, so if you look at the screen here, you can pause the video and look at the differences. Here we have the ICD-9-CM, we have the ICD-10-CM, which is specific to the US, and then you have the characters for those codes. So as a BA, if you are given the job of the project to map the characters of fields for these codes, you should be able to know what those fields, the characters on those fields will be like. So you have 3 to 5 characters for the ICD-9-CM codes. The first character can be numeric or alphanumeric, following by characters 2 through 5, and so on and forth. Okay, so the ICD-9-CM represents only inpatient treatment, and the ICD-10-CM also represents only inpatient treatment. Okay, so we have the codes for outpatient treatment, which is CPT, known as current procedure terminology. We also have supplemental coding system, which is HCPS, used for claims forms. We have 2 kinds of forms which are listed there. So when the codes start having E and V attached to the codes, that's when the diseases are complicated. Okay, so coming to claims. So as a BA, you have to know the kinds of forms used for claim, because of course in the healthcare systems you have the application which is attached to the claim system. A patient goes into the clinic and they are being offered services. At the end of the day, the doctor will be able to file a claim. And if you are the BA given the job to gather requirements regarding automation of the claim system, then you should be able to know what this entails. Okay, so there are 2 types of standardized form used for claims. You have the Medicare and Medicaid forms. You also have the private insurance form. So the claim process is nothing other than a subscriber with health insurance visit the healthcare provider for a doctor's service. The doctor actually provides such services. That doctor uses one of those forms, file for a claim. Okay, that's how the process is. And then at the end of the day, there will be explanation of benefits detailing what the insurance provider will pay on behalf of